So at the end of the day, what do patients want? So generally speaking, when someone comes to see me or someone comes to see a physical therapist, they generally want to get out of pain. And that's usually the most important thing. They want to get out of pain. Secondarily, they want to get back to their activities. And lastly, they really want to figure out how to stay pain-free for the long haul, right? And this is what I generally see with the large majority of my patients. So how might manual therapies fit into this equation? Well, what's the solution? So like we said before, manual therapies provide short-term relief. And like we said before, short-term relief is not long-term relief. If we just do manual therapies versus exercise, the exercise is going to give us that long-term relief. So why do we end up doing the manual therapy anyway? Well, I get headaches from time to time, and I'll tell you what, if I just sleep well the following night, I know my headache's going to go away. But that's going to be, 10 to 16 hours later. Sometimes I have a headache in the morning. I don't want to have an entire day where my head is killing me because I know if I take an aspirin, it goes away just like that, and it's gone. And manual therapies can sometimes do that, right? If you have someone that's in a lot of pain, you do the right manual technique, they may feel phenomenal afterwards. And that is exactly the reason why that patient came to see you in the first place, right? And the other piece is that they may revert right back to the norm. So you help them revert back to the norm more quickly by applying that manual therapy, even though the long-term outcome is going to be the same, right? The other piece is that when someone comes to see you, and this is especially true for really, really painful folks, sometimes exercise just makes them more painful, right? And there's a great argument to be made for folks that are really in pain, and if you get them moving, they feel better. Yeah, you need to push that exercise. And I'm going to push exercise regardless of whether or not I decide to do manual therapies. But oftentimes, exercise just makes people feel worse. And when they're coming to see you, we're looking for something to make them feel better. And manual therapies do that oftentimes, right? And lastly, we want to give them that long-term solution anyway. If someone's coming to see you, I'm going to try to give them the short-term and the long-term. And I'm going to educate them about the long-term as well. I'm going to give them some sort of exercise intervention, and I'm going to do some sort of behavioral intervention or education. Like, look, it's okay that your back hurts right now. The area is just sensitive. Let's not sit down as much as you normally sit just because your back is flared up. When you sit for long periods of time, it bothers you, all right? So temporarily, let's stand a little bit more, and eventually we'll get back to sitting. So I give them the exercise, I give them that behavioral intervention, and I also give them that short-term relief. So the other piece is that, is manual therapy perceived as helpful for the patient, right? Now, we know that manual therapy is sometimes not giving a very clinically meaningful result. But what I will say is that in my personal experience, I've seen a lot of folks that get a ton of relief from manual therapies. And I see some folks that get zero relief from manual therapies. And I see some folks actually get worse with manual therapies, right? So at least in my mind, if I have an individual that does extremely well from a manual therapy perspective, yeah, I'm going to keep doing it. If they get no change whatsoever, I'm not going to waste their time. And if it makes them feel worse, I'm certainly not going to waste their time, right? I'm not going to try to make them feel worse and just tell them like, it's helping you. This manual therapy is what you need. Trust me. No, if it's not working, I'm not going to push it. All right. So right there, you can see that there's going to be some folks that maybe get it and other folks that just aren't candidates. So the other argument was that getting a manual therapy is no better than exercise for a long-term outcome. But at the end of the day, I'm going to let that patient decide. I tell them like, look, if we don't do manual therapies and we just give you some exercises and you don't come in regularly for manual techniques, you're probably going to have the same outcome in the long term, right? And then the patient can make the decision and say, you know what, I like the manual therapies. It's helping me. I'm going to come in regularly for a little bit because I feel like they're giving me a good effect. Right? And they know, right? We're not duping them. We're not telling them like, look, you need this manual therapy. We're saying, hey, the manual therapy can be helpful, but it's not going to change your long-term outcome probably. And they can make that decision, right? So now I'm not duping that person. I'm letting them make their own educated decision. At the end of the day, I'm still going to exercise with them. I'm still going to educate. I'm still going to modify behavior. If I can throw a little cherry on the top and give them a manual therapy that's going to make them feel better, I'm definitely going to do that. And it's probably going to help with that therapeutic alliance. So how about this whole idea that manual therapies are widely misunderstood in our culture, right? So someone, and this happens to me every single day of the week, someone comes in and they're like, hey, are we breaking up scar tissue? Is this scar just really painful and we just got to get rid of it? Are we just getting lactic acid out, right? And of course, I lie to them and I say, yes, you need this manual therapy in order to get better. Joking, kidding aside here, I educate them on what manual therapies do. And I tell them, look, this is probably going to provide some good short-term relief. It's helped a lot of folks that I've worked with in the past. And if it's not helping you that much, then we'll just ditch it, all right? And then most patients, they want to try it. So we give it a go, right? And the other thing is that patients may think that they need it. Right? I can't tell you how many individuals I've worked with that have gone to a provider for years and years, and anytime they're back here, it's like, oh, I need to go to my chiropractor to get realigned. So these folks think that they need manual therapies in order to get better, right? We know this is not the case. This is tough because you're directly disagreeing with what the patient believes in, and oftentimes this kind of destroys your therapeutic alliance, and sometimes the patients never come back, all right? So you have to be careful about that. But I do think it's important that we educate folks and say, like, hey, these manual techniques can be really, really helpful. And yeah, alignment is probably really important for you. But the best long-term solution is probably going to come from doing some sort of consistent exercise program. We have plenty of research to support this. We can do the manual techniques on top of that, but we need to make sure we modify behavior and we give you some exercise, right? That way we're breaking this weird cultural misunderstanding about manual techniques, right? Telling what they need to hear, but we're still trying to go along with their own beliefs and not trying to tell them that they're an idiot for going to their chiropractor for years and that they need to stop doing that right now. The other issue here, and this is an important one, are we causing patient reliance by doing a manual therapy? And I can definitely understand that argument, right? So the patient does not need us to improve. We know that. We're just a guide. We're going to help them get out of pain. We're going to show them the path, right? And what we're trying to do is foster a positive locus of control. We're trying to get patients to believe that they can improve themselves, right? So if someone's too reliant, we're going to have to treat them more frequently and they're going to feel like they need to come back, right? And this is a problem. However, if we educate patients and just let them know, like, look, these manual techniques are a short-term thing. They're going to help you get out of pain probably. If they don't, we can scrap them. The thing that's going to help you in the long term is an exercise program, right? And changing your behavior. Then they're not, I think, as apt to be reliant on you. And again, I couldn't find any research about this, but at least in my mind, if you're really educating your patients, right, you're telling them and being honest about what manual techniques do and don't do, they can make that decision, right? And at the end of the day, people are still going to go to massage therapists, they're still going to go to chiropractors and acupuncturists because they like it, all right? And it's okay to give an intervention if they like it. Now, if you work in a, let's say, an insurance-based clinic, I don't. I'm a cash-based clinic, so I can kind of do whatever I'd like to do. I can really work with the patient and give them exactly what they desire, right? And you can't do that in most insurance-based models. Then you may have a problem, right? Then you may want to make sure that you're giving that absolute gold standard treatment and not getting that person to be as attached to manual techniques potentially, all right? I can see that argument both ways. At the end of the day, if I really fully educate someone and let them know what the manual techniques do, I feel very comfortable doing them, and I think they are beneficial, right?